What should my blood sugar levels be to avoid diabetes? Blood sugar levels for diabetes. Blood sugar is also referred to as glucose. Glucose is the main source of energy in cellular respiration, and so to burn that energy, your body, including its internal functions, needs to be moving sufficiently to avoid the glucose being wasted and turning to fat. You may have a friend who can seemingly eat anything and stay slim and trim, but if you so much as walk past a pie, a pastry or some other baked food, you gain 2 pounds. These person-to-person differences also occur with blood sugar levels. What may be a slightly high reading for you, may be acceptable for someone else, and the reverse could be true. In this video, the 5th in the series of the secrets of diabetes, you'll find out what your blood sugar levels should be to avoid the disease. Before then, don't forget to subscribe to our channel to access other helpful videos, and then kindly click the grey bell icon to be notified of future videos being uploaded to the Natural Health Guys channel. Doctors and other health professionals deal with ranges of blood sugar levels, rather than pointing to a specific number. It's also why diabetes patients frequently test their blood sugar levels. They want to keep it in a healthy range, and they do so with insulin injections, oral medications, as well as healthy nutrition and exercise. And so, as a diabetes sufferer, managing your diabetes condition becomes paramount, and the following key criteria play an important role, as follows. Number 1. Understanding the measurements. In the United States, blood sugar is usually measured in milligrams of glucose per deciliter of blood. In the United Kingdom, Canada and elsewhere, you'll see blood sugar reported as a ratio of millimoles per litre. For comparison, you can multiply a Canadian or British glucose level reading by 18 to create an American reading. If a UK person's fasting blood glucose level is 6, their US reading would be 108 milligrams per deciliter. Number 2. Normal, fasting and post-meal glucose levels. Getting to know your blood sugar level means understanding when and why it can spike and drop. There are many things you eat or drink throughout the day that cause a change in your blood sugar level. This is why diabetes patients will frequently check their levels at strategic points during the day, as follows. 1. If you check your blood sugar level first thing in the morning after you get out of bed before you eat, this is called your fasting blood sugar level. 2. You should also check your blood sugar right before and 2 hours after eating. It's also good to know how a person's blood sugar level has changed over time, as follows. 1. There's a long-term blood sugar test called hemoglobin A1C, sometimes referred to as HbA1c, or just A1C. 2. This test provides you with an average reading over the last 2 to 3 months. 3. Comparing your A1C to your current readings and past A1C results lets you know if your diet and exercise efforts have you heading in the right direction. 4. A1C readings are expressed as a percentage. Number 3. Normal blood sugar levels for non-diabetes sufferers are 1. Fasting equals under 100 mg per deciliter. 2. Before meal equals 70 to 99 mg per deciliter. 3. 2 hours after a meal equals under 140 mg per deciliter, also called the postprandial sugar level, and 4. A1C equals under 5.7%. Number 4. Acceptable blood sugar levels for diabetes sufferers are 1. Fasting equals 80 to 130 mg per deciliter. 2. Before meal equals 80 to 130 mg per deciliter. 3. Postprandial equals under 180 mg per deciliter, and 4. A1C equals under 7.0%. A finger prick blood test and a blood sugar meter can tell you what your approximate blood sugar level is at any moment. If you're not a diabetic or pre-diabetic, you should schedule regular testing with your doctor every year or 2 to ensure your blood sugar levels are at a safe level. A diabetic diagnosis will require testing at the previously mentioned times each day, and possibly even more frequently. In the next video, you'll find out why being overweight increases the risk of type 2 diabetes. We hope you found this video. What should my blood sugar levels be to avoid diabetes? helpful and of interest, so please feel free to share with people you think will also find this video worth watching. And don't forget to leave a comment or ask a question in the comments section below this video. To get more videos like this one, why not become an exclusive subscriber of this channel by clicking on the subscribe button in the bottom right corner of this video? And then click the grey bell icon to ensure you get notified of when the next video is uploaded. If you'd like more information about the many aspects of diabetes for you or anyone you know who suffers with prediabetes, type 1 diabetes, or type 2 diabetes, check out the other videos in this series by clicking on the end screen coming up. And finally, many thanks for watching.